Welcome to Invest Insights. My name is Abby Melone. I'm joined by Dr. Ravi Chari, who is the president of HCA Healthcare West Florida in Tampa. He is joining us for our series on the COVID-19 pandemic and its effect on the business community. Be sure to like and subscribe to watch more videos. Dr. Ravi Chari, welcome.
Thank you. Glad to be here, Abby.
I wanted to start by looking at the accommodations at the hospital, and what are you doing to manage the influx of the patients? Are you seeing a big influx of patients at the moment?
So I think, as you can see from the Department of Health data, the Tampa Bay area is not having the same influx that you see even in Miami, let alone the surge that they're experiencing in New York. However, that doesn't mean we're not preparing as aggressively as any of those other regions. And when I think about the preparation that you ask, there's a number of things that we're doing right now to ensure that we have, number one, the safety of our caregivers is a priority. And number two is the safety then of our patients. And so, as you've seen in the media, this virus is like no other the world has seen in recent history. And so to ensure that we're managing around the contagiousness of it, we've changed a number of policies to make sure that we're minimizing the possibility that it could be introduced in our hospital. This ranges from all the way to restricting our visitor policy, screening everybody who comes into our hospitals, including our own caregivers, with a questionnaire and a temperature check every day. It also means that we're changing how we have the number of access points so we can control how people have entrance into our hospital. Those are kind of some functional things that have occurred in terms of process. We've also then had to deal with another issue that you're also well aware of at the national level, which is the limited quantity of the personal protective equipment, or PPE, as it's been spoken of quite frequently. And so we've instituted key practices. Number one, the key practice, ensuring each of our providers, each of our caregivers at the bedside have the necessary protective equipment to ensure their safety. And that's forced us to really look at the supply chain side, manage it aggressively, manage it in a consistent way to ensure we have the right equipment for the caregivers at the bedside. In addition to this idea of not only managing who comes in and how they come in, managing and ensuring that we have safety for our caregivers, we've also had to prepare for this idea of a surge that you actually started your question with, if we're seeing that. And as I said, the social distancing and the great policy of our governor as well as our mayors in the region have really pushed social distancing, so we're likely not seeing a lot of surge right now. However, nonetheless, we're preparing to expand capacity of our intensive care units, expand capacity of our med surge. So if unfortunately a surge does occur, we're more than capable and prepared. I'll also speak about something that I know is unique in the country and certainly unique in probably the hospital world, is the fact that 4 systems that have been traditional competitors, we're on the phone as CEOs at least twice a week, talking and engaging. And we've even gone as far as to create a bed tracker, a virtual bed tracker for 7 healthcare systems in this region to ensure that if any one system has a surge, we can share the burden. And I want to call out my partners, system partners, John Couros at Tampa General, Tommy and Zena at Baycare, and Mike Schultz at Advent Health, that we've been unbelievably great partners. We've checked our usual friendly competition at the door, and we've really rallied to say, hey, we're in it together, and we're going to be better together for our community.
And I think that you touched upon something that we see all the time in the Tampa Bay region, community and collaboration in the business community, amongst government officials. Hillsborough County had one of the first cases in Florida, and Mayor Castor really put a lot of measures in place to keep the population safe. What can be learned about this collaboration between the hospital systems and the government for the rest of the United States?
I think the first thing I would say, and I would call out Mayor Castor for her leadership here too. We were all 4 of us as the system leaders. She's engaged us right from the beginning, as has the county on the Hillsborough side, as have all the other areas. So our system, HCA Healthcare West Florida, we're actually in 8 counties. And so we have a lot of engagement with a lot of our county leaders and the departments of health. And it's been pretty phenomenal how we've worked together. Hillsborough County, being the most populous, has been the lead in a lot of ways, and then also Pinellas in that same respect. What I would take away that is really emblematic or symbolic of what that symbolizes what we have in this region, it's the transparency and partnership and the wherewithal to be able to rise up and understand that there's a greater good, and together we're better. Early on, all of us identified this. We did, as you mentioned, the first case in the state of Florida actually occurred in one of our HCA West Florida hospitals. And even before that, Mike, John, Tommy, and me had been texting to say, guys, something's coming on. We got to get together, see what each other's doing, share best practices, share the responsibility for this community, and make sure that we're here to respond. And similarly, the county leaders across all the counties that we're part of have acted the same way. So I think what I would really take away, openness, transparency, collaboration, communication, those are the hallmarks of what I see in this Tampa Bay area that put us in a position that I don't think any other region in the country has quite experienced.
The Tampa Bay region has about 20% of its population over the age of 65. How does a hospital system prepare for that particular demographic makeup?
You know, I think that is an important consideration given the fact that there's a predilection of this virus to be more aggressive in an older population. However, we've learned also that this virus doesn't respect any age barrier. It doesn't respect any county line. It doesn't respect any state line. And so we have prepared to accommodate all ages, the youngest of the population notwithstanding, because it appears the virus doesn't seem to affect that group as much. It does affect it, but not to the degree. So again, we've focused and said we've got to have the right bed type, the right PPE, the right care equipment, specifically ventilators. We've got to have the right personnel with the right training to take care of the acuity that comes in. And so we are preparing our systems for all adults, understanding, of course, that the demographic in this region may suggest that as the virus comes in, the number of patients who require hospitalization and the severity might be even higher than experienced in other areas of the country.
And if our viewers want to find out more information about HCA Healthcare West Florida, where would you direct them?
I would encourage them to check out our website at www.hcawestflorida.com. And we'll have a number of links on there, all the way from our different hospital links right through to helplines for them to answer questions that they may have about COVID-19.
Wonderful. Well, thank you again for joining us. My name is Abby Melone from Capital Analytics. Please don't forget to like and subscribe to our channel to watch more videos like this. And again, Dr. Ravi, thank you so much.
Thank you so much, Abby. I've enjoyed it.